Okay, so I was wanting to go ahead and jump on into the different stages of development. Um, Obviously, since we're talking about pediatrics, we're going to be covering the developmental stages of children all the way up to adolescence. So, um, the first developmental stage, as you can guess, is the infant. Now, real quick, it is important before we get into the nitty-gritty of pediatrics, of caring for children and the hospitalized child with illnesses or diseases or conditions. It is important to have a firm foundation of developmental knowledge. So, like the developmental theories, the developmental process, it's important to know this so that you can appropriately care for a pediatric patient and cater to whatever their developmental stage is. And it'll be beneficial to the child, but also the family and ultimately the child's health and you as a nurse. So, getting a firm foundation here really helps in understanding developmental theories. Um, so there are different components of development when we're talking about pediatrics, especially. So of course, there's what you think of automatically when we're talking about development. Um, you think of the physical aspect, the growth, size increase, all of that. And yes, that is true. But we also need to keep in mind their motor skills as well as cognitive, moral, psychological development. And that is another reason why I like to talk about the developmental theorists and their theories, because each one touches on different aspects of development. And it's not all encompassing. Some developmental theorists um, you can agree more with than others, or there are key things that are missing maybe from their developmental theory. But as a whole, it is helpful in forming a basis of what's happening with that child at each developmental phase. So, like some developmental theorists will focus on the moral aspects of development, while others focus on the cognitive or behavioral um, or motor development. So, those are all important to understand. So, just keep that in mind as we're going through each stage of development, that there are so many aspects to it, and it's not just about growing physically, which is important. And also keep in mind that while it is development is predictable, it's also individual. So it's predictable in the sense that we know that, you know, everyone's going to start here at this level, and about this stage, they're going to develop these traits, these that, they're going to grow at this stage. I mean, we kind of have a baseline of what we know each age group how they should be developing. But it's also individual in that not every individual child or person is going to be at the same level as their peers because everyone develops at different rates. So overall, it's predictable, but but it can be individual if we get down to the specifics. I hope that made sense. So anyway, let's jump into the infant. Okay, so milestones, which you'll hear that term a lot when we're talking about growth and development. So it's the general patterns of achievement at different developmental stages. So these are what we call the norms of where a child should be given their developmental stage. So as a nurse, you need to understand, like I was just talking about, the normal range to be able to determine whether this child is on track, if they're developing normally, or if there's a red flag or a divergence, and get to the bottom of that and why that's happening. So for an infant, we need to establish sleep-wake cycles. Social smiles, drinking from a cup, separation anxiety, those are all potential components of of milestone achievements. So each developmental stage is broken into their own little subcategory stages, which I know is a whole lot to remember, but I promise I'm not going to make you remember each subcategory in each developmental stage. I just want you to understand what's going on, what should be normal for that age, and how do you approach a child at certain specific developmental stages? How do you educate them? How do you interact with them? How do you interact with the parents? What would you expect if a parent's telling you their 4-year-old is doing such and such? You need to understand, okay, well, that's normal or that's not, and how to go about addressing it. So just think of it from the nurse standpoint. I'm not trying to have you do rote memorization here. I just want you to form a foundation so that you know how to care for these patients and their parents. So, okay, we have the oral stage, which, as the name suggests, sucking. So that brings comfort and relief from tension. So infants often uh, suck to self-soothe. Um, for example, that's why you'll see a lot of babies that are maybe withdrawing because their biological mother was doing drugs. They need comfort constantly, and that's why they're always wanting to suck, like have something in their mouth to eat. It just helps soothe. Or when a male newborn is getting a circumcision, we always have a pacifier dipped in a little sucrose because that sucking brings them relief. So it's important to hold the infant during feedings to form that bond with the infant. Allow sufficient time for the infant to suck because not all infants are the same. Like I said, this is all individual. Some of them you might need to give them a minute and they'll get to it. Infants that are on IV fluid or nutrition, they do need additional attention and ensure that a pacifier is being used to meet that comfort need, the sucking comfort need. And then when infants are at the stage where they're able to use their hands more skillfully, they will gradually, uh, move away from sucking as a comfort relief and onto other sources. Motor development. So very important. So the grasp reflex, where obviously they're grasping, picking up something, grabbing onto something, disappears around 3 months of age. So with newborns, you'll see that a lot where they'll grasp at maybe your finger and it can be pretty tight and won't let go, but they grasp a lot. And that disappears at about 3 months. Prehension occurs around 5 to 6. Parachute reflex, 7 to 9 months. It's a protective mechanism. And then a pincer grasp will develop and be well established by 1 year of age, which is where, it's more of a fine motor development as far as pinching or picking up something. Emotional development. So consistency is key. Consistency, routine for these little guys is key because it helps develop trust because they have no other means of getting the things that they want, that they need. So keeping a routine really helps build that trust and that comfort for them, and develops a healthy personality. Infants that are consistently picked up when they cry tend to have fewer crying episodes and less aggressive behaviors as toddlers. So I know it's a bit old school now, but they used to say, don't pick up your baby all the time when it's crying, just let them cry it out. Now they're saying that's not so true. That it's okay to pick them up and it's actually good because it helps them develop that trust. They know someone's there, and so they're going to be, at least as far as studies have shown, less aggressive as they get older. So infants will easily accomplish various activities if they're not forced before they're ready. So it is tempting for a lot of parents, and it's understandable why, to force a milestone, a developmental achievement on their infant. But if they're not ready, they're just not going to do it, and it's just going to be a waste of time. Um, and it's better just to let them get there on their own. You'll know when they're ready, they'll start showing signs. When infants show readiness to learn, then provide encouragement. And that's key. So need for constant care and guidance. Again, these little guys, they can't communicate to you what their needs are, what's going on with them. Um, so keep that in mind. So sensory stimulation is essential for the development of the infant's thought processes and perceptual abilities. So keep providing that sensory stimulation. So you see like those mobiles in infant cribs, the little what they have in their, if they have are in a bouncy seat, or one of those, oh, I forget what they're called now. But all those little seats that you put infants in, and they have all those little gadgets that they can grab and pull. That's important because it does help them form perception and thought processes. A crying child should be soothed. Please remember that. They need to be soothed. Again, it's all about that trust. They cannot communicate to you, and they're going to get more aggressive and frantic and crying if they perceive that their needs aren't going to be met when they need it. So if they know, if I cry because I need something, I'm going to get soothed. And of course, that's not the actual thought process going through their head, but that's the gist of it. That's why it's important to soothe a crying child. If an infant appears hungry, don't delay feeding just because you want to adhere to a routine, just for the same reasons I've already talked about. And an infant can recognize warmth and affection or a lack thereof. Um, so that is important. Oops. So coping with an irritable infant. Um, And this is a challenge, especially for new parents and any parents really, but it is a challenge when you have an irritable infant, that it's hard to know what what's going to help, what's going to calm them down. So whether they're irritable or lethargic, many you can use the same interventions for whether they're irritable or lethargic. So an irritable baby cries and is difficult to soothe. I will say you'll see a lot of babies that are withdrawing in the NICU. You hear it called the inconsolable cry. Nothing helps. And it is a cry that is piercing. So it is really hard on caregivers to try to determine what's going on. Whereas a lethargic baby may shut down and sleep to avoid excessive stimulation. In this case, you want to shield the infant's eyes from bright light because that is, you know, an excessive stimulation that they don't need and might make them more lethargic. Um, Sit quietly with the infant, don't talk or sing. Eliminate as much noise as possible. Talk in a soft voice, nice and slow. Swaddle them snugly. They love that. Change their position slowly. Avoid sudden movements. So yeah, be slow in your movements, be slow in your talk. Everything you're doing, just calm, smooth, collected, and provide non-nutritive sucking like a pacifier. For a lethargic infant, some infants respond to an excessively stimulating environment by shutting down and sleeping, like we already talked about. Um, so avoid the bright lights, move and handle the infant slowly and gently, talk in a calm voice, sit upright at intervals, and slowly dress and undress the infant. They're lethargic and they're conserving as much energy as possible. So you need to help in that conservation of energy. All right, so developing positive sleep patterns. So newborns typically, obviously there are outliers, but typically sleep in 4-hour intervals. Um, by 4 to 6 months, they can sleep up to 8 hours. Now, of course, there's variations, but that's typically on average what you'll see. Synchronizing circadian rhythms of infant to family routine is a learned behavior. Um, Safe sleep patterns always position the infant on their back. I'm sure you've all heard the back to sleep campaign. Firm mattress, don't leave anything in the crib surrounding them. Um, and don't swaddle them or cover them um, don't make sure they're not too warm. Infants rely on a parent to soothe them back to sleep if they awake in the middle of the night. So please do that. It assists them in learning to self-soothe, but it also builds that trust. Illness prevention, so parent education. So again, with pediatrics, it's a lot of educating the parents. So stress the importance of periodic health checks, usually well visits, which if you're taking your child to a pediatrician, they know the scheduling uh, time frame and frequency for each age. So make sure you're taking them for that, and that you're educating parents about this. Ensure infant receives recommended vaccinations at appropriate times. This is key. I know that there is a lot going on right now in the world of politics and government, but vaccinations are so important, especially for infants. So make sure you're adhering to those vaccine recommendations. And there are different vaccine schedules. You don't have, there's not just one. There are several. So ask your pediatrician or your family doctor about other options if you want to. Um, Provide education and anticipatory guidance for the developmental changes that occur. So whatever developmental stage they're in, make sure you're providing them that education. Sometimes you can give them pamphlets, or sheets that explain what to expect and what's normal. Monitor growth by documenting measurements on a growth chart. This always happens at a pediatric visit. Um, every height and weight is going to be charted and put on a graph, and that's where you'll hear the doctor say, okay, your infant is in the 50th percentile or 90th, based on the chart. Ensure adequate fluid and nutrition are provided, of course. All right, so physical examination. The first year of life, this needs to happen in a clinic setting at least 5 times. because you're getting hearing and vision assessments, screening tests that are required by law. Some states, every state has some variations to what is required, but the clinic you're taking your child to should know. Growth grids and developmental screenings, immunizations, any nutritional counseling if needed, and education and explanations to the parents. So all of this is meant to help suss out to find if there's any abnormalities so that they're not missed. And again, that might not, if there are issues like with hearing or vision, that might not be determined officially until they're a little bit older, like toddler or preschool. But this is at least setting a baseline. So it's important to get these screenings and preventative measures done to keep your child healthy. And that's what you need to educate parents on. All right, so infants with special needs, early intervention, always essential. Referrals in the community. As nurses, we frequently will provide lots of different referrals to the parents on where they can go for help. Um, and, it can be financially burdensome as well. So helping them figure that out, like giving them resources on that as well. And then early therapies may be needed, like speech, cognitive, or neurodevelopmental. Again, a lot of these like cognitive neurodevelopmental, not always able to determine that at the first year of life. But if the infant does have a condition that these things often coincide with, then it's important to get an early start. All right, so immunizations, like I said before, please stress the importance of this and the timing to parents. And of course, they can consult with their pediatrician or family doctor on what's the best timing schedule for immunizations that they want to follow that works for them. But this is important. Delays can lead to increased risk of illness and death, as we know. And then keeping accurate records of immunizations prevents any unnecessary duplication or confusion for the parents or the family if they move to a different town or a different state or even a different country. So it's important to keep track of that. Nutrition counseling. So for the first year of life, solid foods can be added slowly, starting at 6 months. And that has to do with the tongue reflex, extrusion reflex, that's completely disappeared. And the GI tract is becoming mature enough to be able to digest food. Between 4 to 6 months, sucking is more mature. Munching or an up and down chewing or chomping motion often is seen. Determining adequacy of diet, pretty self-explanatory. If they're growing, great. So the infant has gained 4 to 7 ounces per week for the first 6 months. So that's the guideline is what we want, 4 to 7 ounces per week until 6 months. They have at least 6 wet diapers per day. And this is a easier indicator or an easier way for parents to determine if their infant is well hydrated and getting enough nutrients is how many diapers are we going through a day and how long or how well they sleep through the night. Breastfeeding and bottle feeding. So human milk, breast milk is best for infants under 6 months. Formulas that are cow's milk based and iron fortified are recommended by the American Academy of Pediatrics. Whole cow's milk, do not give until after they're 1 year of age. They cannot digest that. Um, so just remember that education for parents. Absolute contraindications to breastfeeding. So yes, we say breast is best, but there are contraindications, and there can even be personal reasons. It is best and it's good to educate parents, especially new moms, ultimately it's their choice on if they want to breastfeed or formula feed, and that's okay. So absolute contraindications, galactosemia, um, phenylketonuria, HIV positive mother, chemotherapy, radioactive isotope therapy, illicit drug use, and active untreated pulmonary tuberculosis. So these are all things that should be diagnosed pretty early on. Obviously, we'll know if hopefully the mom's HIV positive, if they're on chemotherapy, um, any radioactive therapy, which often is used in cancer treatment. If they're drug users, that can be harder to elicit just because, I mean, a lot of them aren't going to be forthcoming or tell you that they're using drugs. And then pulmonary tuberculosis, not very common, but in other countries, if they come from a different country, it can be. All right, so prebiotics and probiotics. So prebiotics are a non-digestible food ingredient. It indirectly stimulates growth and activity of a microorganism in the gut, and it assures a balance of bacteria that's maintained. Probiotics are protective for the GI tract and often used to treat diarrhea. So all of this is help getting your bacteria, your gut bacteria in alignment. Safe bottle feeding, always check expiration date on containers if it's formula feeding, or if it's stored breast milk. Check the date that was written on that. Follow instructions on how to mix, store, and give the formula. Always use clean containers to mix and store formula. Do not heat in the microwave. I think we've all heard this by now. And don't say formula that's left over from a prior feeding. It can cause diarrhea. So adding solid foods, as we talked about previously, you can start adding solid foods around 6 months of age, slowly, gradually, as long as they're tolerating it. You can start adding different newer foods. But don't do it if the infant is ill because they can have allergic reaction, adverse effects, that kind of thing. Rice cereal is recommended as the first food. Do not mix cereal or baby food in a bottle with formula. Introduce one food at a time in small amounts, like I was saying, and delay adding foods that are well-known allergens to a decent proportion of the population, like nuts, so like peanut butter, fish, eggs, chocolate, that kind of thing. Recommended fat intake. So infants require 3 times more calories per kilogram than adults. Again, we're saying per kilogram. So obviously they weigh less, but still they need 3 times more calories per that kilogram than we do. Um, Easily digestible fats are needed for their development, especially brain development. By 6 months, as we talked about before, the digestive tract has the ability to digest fats that are found in foods. A well-balanced diet provides the appropriate amount of fat and cholesterol, obviously. And please do not give a low-fat diet to an infant. Development of feeding skills. So 4 to 6 months of age, Sucking is more mature. We've talked about that. Munching appears. All right, so weaning. So signs of readiness includes the infant eagerly looking forward to new foods and tastes and textures, getting excited about it. Um, they may not want to be held close when they're eating or during feedings. They may start to bite the nipples as teeth erupt, and intimate parents or imitates parents or siblings. It should be gradual, like I've said before. Start with daytime, like introducing some solid foods or new foods during the daytime. And then in the evening and night, continue with what you had been doing until you gradually can introduce it all day. Organic and natural foods, they don't contain any additives. Strict guidelines on regulations of fertilizers, pesticides, that kind of thing, which is good. Um, if animal, there are no drugs or hormones that are used, which is also good for the developing infant. Um, Nutritive value has not been shown by evidence-based research to be superior to non-organic foods. So yes, while all that's good and not harmful, could be beneficial, but research hasn't shown that. So stress importance of reading food labels. So always read those food labels. Um, we've already kind of went over that. Fruit juices can begin around 5 to 6 months of age when they can start drinking from a cup, like a sippy cup. Delay orange juice until closer to 1 year. And we talked about foods that should be delayed as well. Um, Nutritional needs. Again, we talked about rice cereal being recommended as the first food. Offer small amounts at first, like 1 teaspoon. Place on the back of the infant's tongue, and then you can gradually increase it. Introduce one single food ingredient at a time, and only offer a new food in a 4 day to 1 week period. So you can determine their tolerance to it. All right, so moving on to safety. So car safety. So all infants less than a year and under 22 pounds, rear facing, always rear facing. Fall prevention, never leave them unattended on a flat surface. Always make sure the crib rails are up and secured, and protect any stairways or pools if they're present in the home. Toy safety should be appropriate for their stage of development. No small or removable parts to the toys that they can swallow or choke on. And watch the infant's response to the toy to see if they're ready to learn maybe new skills. So a summary, weight doubles by 6 months of age and triples by 1 year. So rapid development and growth during this stage, huge. The head and chest circumference are equal by 1 year of age. So in the beginning, the head is always bigger. Eventually, that equalizes by 1 year. Maternal iron stores have decreased by age 6 months. So that's when you need to start making sure their infant is getting and enough iron. And then depth perception, that doesn't begin to develop until about 9 months. Infants older than 4 months can roll over. By 1 year, they can take independent steps. And again, this can vary widely, but in general, primitive reflexes are replaced by voluntary movements. And tooth eruption usually begins around 6 months, and that's when the biting and chomping activity begins. Okay, so that was the infant.